Modern medicine has done a horrible job in treating chronic pain and addiction. The fact is that on every street corner you see a pain clinic and places that detox people. All in all, there are still 7 out of 10 Americans, that's 70% of people, are taking at least one prescription drug a day. 100 million people are still in chronic pain, more than cancer, diabetes, and heart disease combined.
My addiction to pain medication started when I had a work injury.
It started when I got into a car accident.
Relapse has become so common in this country that relapse as part of recovery has become a mantra. I don't know about you, but if I have cancer, I wouldn't want my doctor to tell me that relapse is part of recovery. I would want the cancer gone, and that's the way I feel about addiction and the way I feel about chronic pain.
I've been on heavy medications for about three and a half years.
I started taking these drugs when I was 17 years old, and me and my friends took them to get high, and we would find them in our parents' or our friends' medicine cabinets in their houses.
I took these medications for over 21 years.
I don't understand with these horrific statistics that people keep treating patients the same way with the same outdated modalities that simply don't work. You have to think differently to get a different result. I saw this in my own patients many years ago, and that's what made me take a step back and look and ask myself, what am I doing here? Am I trying to get people better, or am I just adding to the same kind of treatment modalities that everyone else is doing that spells failure?
I couldn't do any abstract calculations. I couldn't remember anything.
Have the shakes, I would be sweating, I couldn't get up out of my bed.
My pain was still there, and I was completely chemically dependent on all these prescription medications that I was being prescribed by doctors.
If you really want to get out of pain, if you want to stop taking these medications, free yourself from the bondage that is taking handfuls of pills every day, then you seeing this video was no accident, it was meant to be.
I actually had slipped into depression. I found that I wasn't talking to my family.
I couldn't get up out of bed, people didn't want me to drive, my kids were so angry at me, they're embarrassed.
I lost my relationship with my wife and my children.
When I changed course, I started using DNA testing, balancing brain chemistry to get people off these painkillers and other medications like antidepressants, anxiety pills, sleeping pills, once and for all.
Nest program, when I first got in it, the idea was to calm down my nerves and kind of restart my system.
If you get connected with the Nest program, that's what it'll do for you. It'll give you natural solutions to the pain.
Nest program taught me supplementation, healthier eating, how to exercise without hurting myself.
I can go to work, I enjoy going to work.
My memory started to improve, my logic started to improve.
I enjoy seeing my parents, doing things with them, my kids. It's just a much better life now.
I told a friend of mine the other day that my 50-year-old body can't keep up with my 30-year-old brain right now because I feel great.
I don't want you to become one of these statistics. Get help, get the right help, and get it now.